All right, so we just reviewed our pathways on the whiteboard another time in class, which again, this is just a topic you're going to have to do it over and over and over and over and over again to understand it. But that was the illustrative approach to these pathways, and the way that I've rebuilt this part of the lecture is that I have sort of given you some explicit slides for each of these pathways. So for the anterolateral pathway, also known as spinothalamic tract, that information is pain and temperature. It decussates within the spinal cord, usually at about the level of the spinal nerve that it's connected to. So like if it's from your arm, then it's going to decussate on the level of your spinal cord coming from your arm, right? Travels anterolaterally until the brainstem. Don't worry too much about it going dorsal in the brainstem. There is clinical correlate there. And there are 3 neurons in the circuit with the last synapse within the thalamus. BCML carries light, touch, vibration, proprioception information. I really like this picture of just like poking your dog's neck real quick. That's great. It decussates within the brainstem, specifically in the medulla oblongata. There are 3 neurons in the circuit. The last synapse is in the thalamus. And here's one of the reasons I'm telling you all of this. Because of the different decussation sites for your 2 different sensory pathways, if somebody has a really specific lesion of their spinal cord, let's say you cut half of your spinal cord, you could lose pain and temperature on one side, and you can lose fine touch, vibration, and proprioception on the other side. That is something that can happen if you bisect the spinal cord just on one side because of their differing decussation sites. And finally, the motor pathway is a descending projection tract. So it's going to start from the brain, it's going to move to the body. And again, your textbook's going to illustrate it a little bit differently than I am, and that's okay. We can roll with it. Upper motor neuron from the cerebral cortex is going to decussate in the medullary pyramids of the medulla oblongata. And it's going to go straight down to the level of the spinal nerve, where it will exit that lateral funiculus and synapse onto a lower motor neuron within the anterior gray horn of the spinal cord. The reason this says within a brainstem cranial nerve nucleus, everything I've illustrated up here was for the body. Remember that we have sensory and motor to face coming from cranial nerves, right? So trigeminal is sensory from the face. So instead of having this full pathway through the spinal cord, it's actually just staying up in the brainstem, right? But it's still going to be functionally similar in terms of ascending pathways, descending pathways, afferents and efferents, and the number of neurons in the circuit are going to be pretty similar. We already know that that lower motor neuron is releasing acetylcholine because we've already met this lower motor neuron at our neuromuscular junction in our muscles unit. We just worked our way backwards. So just think about it. We worked our way all the way back from skeletal muscle to a lower motor neuron to an upper motor neuron to the primary motor cortex. That's what we've done over the last several weeks. So for most of these, if there's anything vague like this, direct and indirect pathways, just know the definition. I'm not going to focus too much on them, but you should know their definitions. Direct pathway is conscious control of skeletal muscle activity. Indirect pathway includes unconscious control of skeletal muscle activity. And that's it, just know those definitions. And that's actually where we stop. We'll pick up with the rest of these concepts during week 10, and then we'll continue into our autonomic nervous system lecture, just because you guys tend to peace out after the pathways portion of it. Any questions before I turn off my 4-minute recording? It's too short of a recording. Oh well. Questions, comments, fears, hopes, ambitions, dreams? Okay, stopping recording.